Hello, my name is Alina McGarrigle. I'm a GP in Newport in South Wales, and I'm simply going to talk today about how I would approach a patient who is requesting a PSA.
Alina, please tell us more about the PSA test. I understand it's just a simple blood test.
Yes, it is, and very importantly, all men over the age of 50 are entitled to request a PSA check from their GP, as endorsed by NICE guidelines. And if they're in an at-risk group, that age is lowered to 45. I'm always encouraged when a man comes in to ask for a PSA check. And I say this because prostate cancer, which tends to be a disease of older men, is now the commonest cancer in the UK. There are about 55,000 new cases being diagnosed every year and up to 12,000 deaths annually. Unfortunately, as yet, there is no screening test for it. So we have no screening program for it. And yet 1 in 8 men may get prostate cancer in their lifetime. It is, however, completely curable if it's caught early. To be clear, the PSA test is not a screening test, it's a health check. And I'll say a little bit more about that later, but it is believed to be saving lives.
And why should a man consider asking for a PSA test?
So the first thing I always ask is what made the patient inquire about a PSA check? And sometimes it could be he considers it a good way of looking after his health, or a family member considers it a good way of him looking after his health. They may have seen the adverts on television. It may, however, be that there is a family history of prostate cancer, which will increase the risk by 2.5 times. Very importantly, men of an African or African Caribbean ethnicity have a 1 in 4 chance of getting prostate cancer. And so I would really say a chat with their GP could be invaluable. So this question isn't just an opener, it's really to find out if the patient is in an at-risk group as well.
So, Alina, can you tell me about the prostate and does checking involve any physical aspect?
So not all men know where their prostate is. So what I would first do is just briefly explain that the prostate sits just below the bladder, and the back part of the prostate can be felt when a rectal examination is undertaken. Unfortunately, a lot of men think that if they are going to ask for a PSA check, they automatically have to have a rectal examination, and it puts them off coming to ask about the PSA check. I just need to make it really clear that nobody should ever have to have an examination they don't want. And the rectal examination isn't quite as important as it used to be, although it obviously still has its uses. I certainly don't ask a man to have a rectal examination just if he's simply asking for a PSA check. If, however, during the course of our discussions, it appears that he has urinary symptoms, then I may suggest one and I would explain the reasons why, but he still has the right to refuse. I would also offer a rectal examination if the PSA was found to be high. The reason for this is that although the rectal examination only feels the back of the prostate, if it felt hard and irregular during that examination, it would alert the urology team to the fact that there may be a suspected cancer. And so it would stop delay in diagnosis, especially if the PSA was only just marginally raised.
What are the obvious symptoms of prostate cancer then?
Well, this leads me to the fact which is really important, which is that 80% of men who have localized prostate cancer have no symptoms. But unfortunately, 20 to 30% of men who do have symptoms have already got disease that has spread. So it's important to be aware of the symptoms to look out for, which may indicate prostate cancer, but might also be a sign of something else. So you need to look for symptoms such as passing urine frequently or getting up at night to go, having difficulty in starting to pass urine, straining to pass urine, having a poor stream, feeling that your bladder hasn't emptied fully and that it feels uncomfortable, or there's blood in the urine. It's really important, though, to reiterate that these can be symptoms of other conditions as well. But whatever, you need to have your GP check them out for you and just don't put them down to symptoms of old age. There are other symptoms as well, which can include blood in the semen, pain on ejaculation, erectile dysfunction, fatigue and unexplained weight loss, and also pain in the bones, particularly around the pelvis and hips. Now, unfortunately, some of these symptoms may indicate that there is more advanced disease.
From what you said, what does a PSA test give us?
So, as I've mentioned, we don't have a screening test for prostate cancer, and 80% of men have no symptoms with localized cancer. So I would then discuss the PSA test, which is a very cheap blood test. It can't be considered a screening test and can only be considered a health check. And the reason for this is it can be raised for a number of reasons. It actually rises as a man gets older, but it can also be raised for other medical conditions or urological conditions, such as benign enlargement of the prostate. I'd also have to counsel a man that 75% of men with raised PSAs, especially if that PSA is only in single figures or in the teens, will not have prostate cancer. And 15% of men with prostate cancer have a normal PSA. Men, therefore, might go through all the anxiety and unpleasantness of having an MRI scan and the biopsy, only to find that they haven't got cancer. There is some concern that this may lead to significant mental health problems with some men, and doctors are really very well aware of that. I suppose the argument to that, though, is that if you find that you haven't got prostate cancer, that is just excellent news anyway. So I think it's really important that a man should make that decision himself, and he should not be influenced either by a clinician such as myself or by family members, so that he's happy with the decision that he's made.
So what are the simple rules of having a PSA test?
So if the man decides he would like to proceed with a test, there'll be some simple instructions. So a PSA test shouldn't be done within 6 weeks of an active urine infection or prostatitis, which is an inflammation or infection of the prostate. It also shouldn't be done within 6 weeks of a urological intervention, such as a prostate biopsy. We wouldn't do a PSA test within 48 hours of vigorous exercise, which includes cycling, and it shouldn't be done within 48 hours of ejaculation. The rectal examination can also cause a transient rise in the PSA, so we wouldn't do a blood test within 3 days of having the rectal examination.
Now, what happens if the PSA result is high?
So if the result is high, that's when I would invite a man to come back in to discuss the result. And at that point, I would offer the rectal examination. I would make a referral to urology as per local guidelines. If the PSA is lower, sometimes it just means that that blood test has to be repeated within a certain amount of time. But if the patient has actually agreed to the rectal examination and the rectal examination feels abnormal, then I would still do the referral and alert the urology team to the fact that although this was a low PSA, it looks like this is a prostate cancer, so that diagnosis isn't delayed.
And if the test is normal, what happens next?
So with a normal PSA test, we then have to decide when to do the next one. And there are no real guidelines on this, but further tests could be determined by the actual figures shown within the result. So there has been a suggestion that a PSA of 2.5 or above would indicate for a man to have yearly PSA checks. And if it was lower than that, then perhaps he could have them less frequently. I always advise a man that he should keep a record of his figures, the figures themselves, so he would be aware of any spikes, as we would be in surgery, as we would also have the results. So really, in conclusion, all I would say is that for anyone who has a prostate, it's really important to be aware that the PSA test is there and it's available, and just to have a chat with your GP to see if you feel happy to have it done, because we do know, or we certainly believe, it's saving lives. Thank you.
Alina, thank you so much for providing such clarity to this subject, and I hope it will inspire men to ask for this simple PSA blood test to check out the health of their prostate. Thank you.
Thanks.